Thank you all for joining us for the bone marrow transplant education class. This portion will go over medication use. My name is Kelly Hawks. I'm one of two pharmacists that work with the bone marrow transplant program. No matter where your loved one is, whether he or she is on the 10th floor, which is the inpatient unit, or the 7th floor, which is the outpatient clinic, there's a bone marrow transplant pharmacist available for any questions that you may have, so please always ask to speak with one of us if you need that. As we go through the information today, I'd like you to keep in mind whether your loved one is receiving an autologous transplant, which is when they receive stem cells from their own self, or whether they're receiving an allogeneic transplant, where they receive stem cells from a donor, either a brother or a sister or an unrelated donor or a cord blood donor. Most of what I say today will apply to both autologous and allogeneic transplants. However, there are a couple of things that will just apply to patients who receive an allogeneic transplant. Before I get started, if you have not already received a copy of the handout, you can either receive a copy of the handout by contacting Lynn Hoffman, who is our discharge coordinator and the coordinator of this course, or you can click on the link on our website to my handout, and on the top it says medications after bone marrow transplant, what you need to know. So if you'd like to pause and take a moment to get a copy of the handout before we proceed, please go ahead and do that at this time. The first thing that we'll talk about are what types of medications you can expect your loved one to be taking after their bone marrow transplant. And the first group of those medications are ones that we use because your loved one will be at an increased risk of infection. And this is for a couple of different reasons. The first reason is your loved one will receive high doses of chemotherapy or radiation prior to their bone marrow transplant. And this can cause their white blood cells to be low, and white blood cells help the body fight infection. When those are low, we worry that your loved one can get sick more easily. Patients who receive an allogeneic transplant are also at an increased risk of infection because they're on medications that specifically suppress or weaken their immune system. So they're at the highest risk of infection. You may notice that after transplant, your loved one is discharged on medications to prevent viral infections, fungal infections, and bacterial infections. So of course, these will be really important medications to take as directed. We also want you as the caregiver to help us monitor for these infections. The best way for you to do that is to make sure that you have a thermometer at home. We recommend that the thermometer be one that you can use in the mouth or in the ear. We do not recommend thermometers that go under the arm or rectal thermometers. And the temperature that we want you to call us is on your handout. It's 100.5 degrees Fahrenheit. So if your loved one has a temperature of 100.5 or higher, we do need you to give us a call immediately. We have phone numbers available for you, typically in the white binder that you will have received from your pre-transplant coordinator. That lets you know what phone number to call at different days of the week and different times of the day, so that even if it's overnight or on a holiday or a weekend, you're able to contact someone within the bone marrow transplant program that understands the unique infection risk that your loved one has. So what do you do if your loved one complains of feeling unwell and you take their temperature and it's normal? We still want you to give us a call because there can be situations where your loved one is ill without having a temperature. The next group of medications we'll talk about are those that we use to prevent graft versus host disease. And graft versus host disease is a complication that occurs only in patients who are receiving an allogeneic transplant or stem cells from a donor. So this section does not apply to those of you caring for someone receiving an autologous transplant or cells from themselves. Now there's going to be a separate section at the end of this class specifically about graft versus host disease, so I won't go into it in detail, but in short, graft versus host disease occurs when the stem cells from your loved one's donor don't recognize your loved one's body as a home. They see it as a foreign or new place. And a reaction can occur where you can see a bright red skin rash if the skin is affected. The skin rash can appear like a sunburn. We can also see stomach upset and loose stools or diarrhea if the graft versus host disease affects the lining of the stomach tract. And we can also see changes in the liver labs that we monitor in the hospital and in the clinic if the graft versus host disease affects the liver. So of course, this complication is a very important one to prevent. The most common medications that you'll see your loved one taking to prevent graft versus host disease, the names are on your sheet: tacrolimus and cyclosporin. Your loved one will either be taking tacrolimus or cyclosporin. They would never be taking both, and they would never be taking neither. So please keep those two names in your mind, because we're going to come back and talk about these medications a little bit more when we look through an example medication sheet in just a little bit. A couple of things to note about many of the medications that we use to prevent graft versus host disease, as well as some of the medications that we use to prevent infections, so this would apply to everybody in the class, are that many of these medications can increase the risk of sun sensitivity and sunburns. And sunburns are actually linked to graft versus host disease. So it's very important that all patients, both allogeneic and autologous transplant patients, wear sunscreen with at least an SPF of 30. So please make sure that you go ahead and pick that up. We recommend that patients cover any areas of exposed skin that will be exposed to sunlight longer than traveling to and from your home to your car and to the clinic. So even a short walk outside, it's important to go ahead and wear sunscreen at all times. So again, we're going to come back and talk about tacrolimus and cyclosporin a little bit more in just a moment, and return to those graft versus host disease medications. The next group of medications I'll talk about are those that we use to prevent nausea, upset stomach, and vomiting, which I know can be a little bit of an anxiety-driven topic to discuss, as many patients are very concerned about nausea and vomiting throughout their cancer treatment as well as their bone marrow transplant. But the most important take-home point that I want the caregivers to take with them is that we've come a very long way in our ability to manage these symptoms. So I don't want anybody thinking that they should have to suffer or feel these symptoms simply because they have a cancer diagnosis, are undergoing chemotherapy, and receiving a transplant. I can't tell you the number of patients that say, well, I'm getting chemotherapy, I should just expect to feel unwell, so I'm not going to complain about it. But think of all of the important downstream effects of nausea. If a patient's nauseous, they're not eating well, so they're losing energy. They're not drinking well, so they could be at risk for dehydration, which can harm the kidneys. If they're nauseous, they're certainly not exercising, so again, losing strength and energy. So these are all very important reasons for us to prioritize controlling symptoms of nausea and vomiting. So we take this very seriously. And again, we've come a very long way in our ability to manage these symptoms, and there's always more that we can do. Having said that, there's a couple of measures that we take for all patients to limit and prevent nausea and vomiting as best we can. The first thing that you'll notice is that your loved one will go home on a medication that targets stomach acid. So I get a lot of questions about why patients are receiving these medications if they've never had a history of heartburn, for example, but we find that when we give a medicine that targets stomach acid, patients are better able to tolerate their food and better able to tolerate their pills immediately post-transplant. Now, if they don't have any stomach upset or nausea and vomiting complaints after about a month after transplant, we can typically discontinue the stomach acid medication. The most common names of these medications that you may have seen on television commercials or over the counter are medications like Pepcid, Prilosec, and Nexium, those types of medications. We also will send all patients home with at least 2 different medications to use on an as-needed basis to prevent nausea and vomiting and treat nausea and vomiting when it occurs. So these medications would not be medications that patients would take on a specific schedule, morning and night, for example. These would only be medications that you could have on hand to use as needed if your loved one did experience nausea and vomiting. And when we look at the example medication sheet, we'll go over what these medications are and a little bit more about how to use them. So again, overall, please know as the caregiver that we take managing nausea, vomiting, and upset stomach very seriously. And there's always more that we can do to customize a plan based on your loved one's specific triggers for their nausea and vomiting. So please let us know if we're not doing a good enough job managing these symptoms. The next group of medications I'll talk about are home medications. And I like to mention home medications while your loved one is getting ready to go into the hospital or while they're in the hospital, because you may notice that some of their home medications are not being given to them during their inpatient stay, and that can be alarming. However, we typically have a reason to hold some of these medications during the bone marrow transplant, either because those medications have a drug interaction with some of their chemotherapy, for example, or an overlapping side effect with the chemotherapy that we want to minimize. So again, please don't be alarmed if you notice that one of your loved one's home medications is not being given to them, but go ahead and ask us if you're concerned so we can explain to you why it's being put on hold. I'm going to move to the second page of the handout. Now that we've talked about medications that you can expect your loved one to be taking after transplant, I want to review a couple of medications that you should consider not administering to your loved one or asking about before you would administer to them. So again, I'm going to return to those home medications. Typically at the time of discharge from the 10th floor, which is the inpatient unit, to the 7th floor, which is the outpatient clinic, we're able to resume many of those home medications that may have been put on hold during the inpatient stay. So this is a good time to readdress that initial home medication list that you brought with you on your admission to the hospital. The next group of medicines you could think about asking about are herbal medications, vitamins, and supplements. We have many patients and caregivers that are interested in some of these medications, either to supplement a diet that you don't feel is back up to normal, or to manage a symptom or a side effect related to their cancer treatment. And while many of these medications are marketed as all natural, they often have very significant drug interactions and side effects. So please do let us know about any herbals, supplements, and vitamins that your loved one is taking, just so we can monitor and make sure that there are no drug interactions or side effects we need to be aware of. This includes things like dietary supplements and shakes that we would want to know the quantity that your loved one is taking, and any over-the-counter medications. The last group of medicines that you want to think about asking before you would administer to your loved one are medications that increase the risk of bleeding. We talked a little bit before about how chemotherapy and bone marrow transplant can cause white blood cells to be low. It can also cause platelets to be low, and platelets are the blood cells that help clot blood. If you were to have a cut or a bruise, the platelets would go to that area and clot blood. So while platelets are low, we need to avoid any medications that affect the platelets or increase the risk of bleeding further. And there are many medications available over the counter that are commonly used by the public that can do this. The most common medication that affects platelets is aspirin. Many of you probably know someone who takes aspirin for heart health. And this would be a medication that you would notice has been put on hold when your loved one is on the 10th floor and remains on hold for at least a number of days to weeks after transplant. Another group of medications that increase the risk of bleeding are called NSAIDs, or non-steroidal anti-inflammatory drugs. And these are pain medications that you would commonly know as ibuprofen, Motrin, Aleve, naproxen, and Advil. So these medications should not be administered to your loved one for minor aches and pains until we let you know that it's safe to do so. So what is a good option to use for minor aches and pains? We would recommend acetaminophen or Tylenol, and I often counsel caregivers that it's not a bad idea to go ahead and pick up a bottle of over-the-counter Tylenol to have at home to use on an as-needed basis instead of reaching for one of those NSAID medications. I often get questions about if it's safe to use acetaminophen or Tylenol after transplant, because as we know, this medication can also decrease a fever and could cover up a fever that we've talked about how important it is to monitor for fevers. However, if you're only using the acetaminophen or the Tylenol on an as-needed basis, for example, once a day or once or twice a day, a few times a week, we're not concerned that you would significantly increase the risk of covering up a fever. So it is safe to use this medication on an as-needed basis. Now we're going to shift gears a little bit and talk about preparing for discharge. Certainly, sending your loved one home from the 10th floor of the inpatient unit can be a little bit of a daunting thought after the lengthy admissions that some of our patients have. So I've listed a couple of important points that we take here at VCU to help make that transition as smooth as possible. So the first bullet says 3 to 4 days before discharge, our discharge coordinator is going to come and speak to you and your loved one about your home prescriptions. So at this point, it would be really important to have your most up-to-date prescription drug insurance card with you so that we can send this to your pharmacy along with your prescriptions. Also, if you know that your insurance company prefers or requires mail order pharmacy, this would also be an important time to tell the discharge coordinator that mail order pharmacy is preferred. I'd also like to take this time to talk a little bit about the different pharmacies that are available in the Richmond area so that you can start thinking about what the best pharmacy for you and your loved one will be. We have many patients that are from the Richmond area, but we also have many patients that are from out of town and will be staying with us in Richmond throughout the transplant. My recommendation for what pharmacy to use for most patients is going to be to continue using whatever community pharmacy you used prior to transplant. So for example, if you used a CVS pharmacy in Richmond, we would recommend to continue using that CVS pharmacy in Richmond. If you're from Virginia Beach and used a Walgreens, we can help find the closest Walgreens to where you're staying here in Richmond. We have all of the major chain pharmacies and grocery store pharmacies in Richmond, so we can help you find that pharmacy equivalent where you're staying. If you use an independent pharmacy where you're from, we have 2 independent pharmacies in Richmond that we work with very closely that I would recommend for you, as well as recommend for anybody interested in using an independent pharmacy. The first pharmacy is called Buford Road Pharmacy, and this pharmacy is about 10 miles from the hospital. One nice feature of this pharmacy is they do free deliveries within a 10-mile radius. So if you are staying at the Doorways, which is our contracted housing for patients and caregivers, they will do free deliveries to the Doorways for you, which can be a very nice and convenient feature when you have a busy clinic schedule. Another independent pharmacy in Richmond is called Westbury Pharmacy, and this pharmacy is about a 15-minute drive from the hospital and is located on the north side of the river. They also do deliveries within for a $3 charge. So again, a nice feature if you're looking for something that will do deliveries for you. We also have pharmacies here at the hospital at VCU. The only patients and caregivers that are required to use our VCU pharmacies are those of you who have spoken with your pre-transplant coordinator or a social worker about a VCC code, which is a code that helps with co-payments. If you have not talked with your pre-transplant coordinator or social worker about a VCC code, then this would not apply to you and you do not have to use our VCU pharmacies. Of course, you may be interested in using our pharmacies as you'll be in the clinic frequently. I do want to just caution you that the outpatient pharmacy that we use after transplant, called the ACC pharmacy or the ambulatory care center pharmacy, is often associated with a long wait time, on average of about 2 hours. So while our pharmacies are on site and may seem to be convenient, it's important to know that some planning and patience is required when you use our VCC pharmacy, our ACC pharmacy, simply due to the very long wait times that are associated with our pharmacies. And this is the reason that I typically recommend to continue to use your community pharmacy if you're able to do that. If you have further questions about what pharmacy is going to work best for you and your loved one, please feel free to reach out to Lynn Hoffman, our discharge coordinator, or the inpatient pharmacist when you are up on the 10th floor receiving your transplant, and we can go over the options with you in a little bit more detail. So let's go back to our handout. Under the Preparing for Discharge section, the second bullet point says 1 to 2 days before transplant, a pharmacist is going to come and counsel you and your loved one on your medications and provide you with a medication sheet. So if you have the handout, please go ahead and flip to the 3rd page, which is an example of a medication sheet. We're also going to pause this recording and zoom in on a larger picture of the medication sheet that I'll go over with you in detail. Okay, so if you were able to flip to the example medication sheet, we're just going to go over the structure of the sheet. And what I want to remind you is that this is simply an example. Your loved one may be on none of these medications, or your loved one may be on all of these medications. I simply want to show you the type of information that we're going to provide you with to help you keep things organized at home. The medication sheet can also be longer or shorter, depending on how many medications your loved one was taking before transplant, as well as if your loved one received an autologous transplant, which is usually a shorter medication list, or an allogeneic transplant, which is usually a bit of a longer medication list. So at the top of the page, you'll notice first the patient's name. The date prepared is important to note. Every time there's a change to your loved one's medications, you're going to get a new medication sheet. So you always want to keep your eye on this date prepared so that you have the most recent copy with you at all times. At the bottom of the sheet, you'll see the name of the person who last updated your sheet so that if you have a question, you know who you can go to ask for clarification. The first column of the medication sheet is the name of the medication, as well as the strength of the tablet or capsule that was prescribed. The next column is the dose of the medication, the route, typically by mouth. This middle section is an example of a time schedule. And please keep in mind that the times that we use on the medication sheet are customizable depending on what time your loved one gets up in the morning, what time your loved one goes to bed at night, and when they eat their meals. The time schedule is most important for us to note for you when medications need to be taken with food or without food, or for medications that need to be separated from one another due to drug interactions. The last column shows you the purpose of the medication, why your loved one is taking it, and any important notes to watch out for. So next we'll go through a few examples so that you can get an idea of how the medication sheet flows. The first medication I'd like to talk about is this tacrolimus, the first medication on your sheet. And you'll recall that when we discussed graft versus host disease, I asked you to keep the names tacrolimus and cyclosporin in your mind, as these are the two most common medications that patients will use to prevent graft versus host disease, again, only in our allogeneic transplant recipients. Your loved one will either be taking tacrolimus or cyclosporin, and everything that I say about tacrolimus can be substituted for cyclosporin. So you'll see that tacrolimus was prescribed for your loved one. You will receive two different bottles from the pharmacy, one with 0.5 milligram capsules and one with 1 milligram capsules. So you want to make sure that you don't mix these two different bottles up. The dose tells you to see the schedule. The route is taken by mouth. And when you look at the schedule, you can see that the dose at 8 a.m. is 2 milligrams, and the dose at 8 p.m. is 1.5 milligrams. So your loved one will have to take 2 of the 1 milligram capsules in the morning, and in the evening they'll take 1 of the 1 milligram capsule and 1 of the 0.5 milligram capsules. When you look in the purpose column, you can see that the tacrolimus is used to prevent graft versus host disease. It lets you know a couple of side effects to watch out for. It can cause a tremor, which most likely we see as a shaking in the hands like this. And you can also see headaches. So if your loved one were to complain of these symptoms, that would be something to let your nurse or doctor know about when you come to clinic. It also reminds you to hold your morning dose on days when a blood level is due and to bring the medication with you to clinic. So the tacrolimus and cyclosporin are medications that are dosed based on a blood level. So they're different for every patient taking the medication. If the blood level is low, we worry that graft versus host disease can happen, and we need to increase the dose of the medication. If the blood level is high, we worry about side effects of the medication, and we would need to decrease the dose. We monitor these blood levels of tacrolimus or cyclosporin about twice a week, every 3 to 4 days, and adjust the dose accordingly. So on days that that level is due, we want to get the level immediately before this morning dose. So we would want you to hold this morning dose until after the blood is drawn. Then we could go ahead and make any adjustments needed based on that blood level, which is why it's important to bring your dose with you to clinic. This is the most complicated medication on the list, so please ask questions at the time of your discharge counseling to clarify this information if you need to, but I promise the rest of the sheet will flow more smoothly. The next example I'd like to go over on the medication sheet are the last 2 medications. And these are the 2 most common medications that we prescribe to use to treat nausea when it occurs and use on an as-needed basis at home. The first medication is ondansetron or Zofran, and the second medication is prochlorperazine or Compazine. Now, if your loved one knows that one of these medications does not work for them, or if they have a different nausea medicine that they prefer, we can certainly customize that for your loved one. These are just the two most standard medications that we prescribe to have on hand at home to use on an as-needed basis. When you look at the time schedule, you can see that there are not X's to indicate when the medication should be taken at specific times. It simply says to take one tablet 3 times daily as needed for nausea. So again, these are just medications to use on an as-needed basis. Again, you'll receive counseling on your medication sheet a day or two prior to discharge, and every time there's a change made to your medication sheet, you'll get a new copy in the clinic. So please do make sure that you note that date prepared and the name of the person who last updated it if you have any further questions. I hope this medication sheet gives you a little peace of mind of the type of information we're going to supply you with to help you keep your medications organized at home. Now we'll return to our handout and we'll pick up from there. Okay, we'll return back to the handout. Under the Preparing for Discharge section, the third bullet point says 1 to 2 days before discharge, think about making a plan for organizing your medications at home. Typically, patients after transplant go home on a number of more medications than they were taking before transplant, so it's important to think about a couple strategies that may help you keep things organized when you're back home. The first strategy is simply the medication sheet. I have many patients and caregivers that tell me that they keep their medication sheet with them at all times and they just read it all the way through a few times a day, and that's all they need to help keep their medications organized. However, some patients need a few more strategies. The first one I like to talk about are pill boxes. Many of you have seen pill boxes that have one compartment per day, but there are larger ones that have a morning, noon, evening, and bedtime compartment for each day. And there are pill boxes that are even larger than this that have larger compartments for larger tablets and capsules and larger print if your loved one has difficulty reading small print. I also like this specific pill box because you can pop out a day and you can take it with you when you come to the clinic so that you don't have to carry all of your medications with you at all times. One word of warning about using the pill box is that medication changes do happen frequently. So at least initially after transplant, I would recommend that you only fill a couple of days at a time, because if it is Monday and we make a bunch of changes and you've filled your whole box, you're going to be moving pills around and picking things out and reorganizing them. So at least until you get into the flow of clinic and get into a rhythm with your medications at home, consider only filling 2 to 3 days of your pill box at a time because it is common to have those frequent medication changes. Another strategy that I find to be really helpful for patients and caregivers is to use timers and cell phone alarms. Most patients have a cell phone with them at all times, and setting repeat alarms for troublesome times of the day when they have a medication due can be really helpful to not miss that dose. Most folks do really well with their morning medications and their evening medications, but medications that are due in the middle of the day can often be difficult because your schedule is fluctuating and these can get missed. So think about setting timers and cell phone alarms on a repeat basis to make sure that you don't miss any specific times during the day. Next, we'll move on to the section of what to expect in the bone marrow transplant clinic. The first bullet reminds you to bring your medication sheet and your medications with you to your clinic appointments. I think the medication sheet is a great place for you to jot down notes and questions for the doctors and for the nurses and pharmacists if you have them, and bring that with you so that you can compare your old sheet to any changes that were made at your appointment. We also ask that you bring medications with you to your clinic appointments that your loved one takes in the middle of the day, as often clinic appointments can be unpredictable and maybe more lengthy than you anticipate. So anything taken during the middle of the day and anything taken regularly on an as-needed basis would also be helpful for you to bring to your clinic appointments. Again, changes are made to your medication sheet frequently, so please do make sure you get a new medication sheet every time that you have a change made to your regimen. And the last bullet point talks about IV or intravenous medications. I like to mention this here in the class so that it's not the first time you hear about IV medicines if you do need to take an IV medicine at some point after transplant. I want to let you know that we work with a really great home infusion company that has nurses that come to the clinic or come to your home to do education on how to administer the IV medications to make sure you feel comfortable doing it at home before you have to do it alone. It's not uncommon to need an IV medicine at some point after transplant. The most common reason for this would be a simple bacterial infection that we would need to treat with an IV medicine. So instead of admitting your loved one to the inpatient hospital for this treatment, we could do it at home with IV medicines that you administer to your loved one at home. So again, if you're ever told that you need an IV medicine, please know that we work with a great company that's going to help make sure you feel very comfortable with how to do the administration. The last section I'll talk about are a couple of quick medication safety tips at home. We ask that you keep your medications in a cool, dry place away from children and pets. So we ask that you not keep your medications in the bathroom or anywhere in the kitchen above the sink or the stove where heat and steam can affect the integrity of the medications. I get a lot of questions about how to safely dispose of medications. Most of the time, I recommend that you don't throw away medications after they're discontinued. And the reason for this is we often will stop a medication, but then want to restart it in a number of weeks to months after transplant. And as long as the medication is not expired, it would be safe to go ahead and use your old medication supply to save yourself a copayment. I typically recommend to get a shoebox or a container and label it old medications so you can keep these medications that have been stopped separate from the medications you're currently taking. But just put those medications in that box and save them just in case we want to resume it at a later date. If you decide that you truly are finished with a medication and you want to dispose of it, most medications can be safely disposed of in the general household trash. We ask that you mix them with something undesirable like coffee grounds or garbage, put them into sealed containers such as a milk carton or a coffee can, and throw them away in the general household trash. And this just deters animals from going through the medications in the landfill. If you have medications that you would consider higher risk, such as blood thinning medications or old chemotherapy medications, and you have questions about how to dispose of them, please just go ahead and ask us in clinic and we can go over that information with you. This is the end of the section on medication use after bone marrow transplant. Again, if you have any questions, please know that there is a pharmacist on both the 10th floor, the inpatient unit, as well as the 7th floor in the clinic, and we're always available to go over any medication-related questions that you or your loved one have. And I look forward to seeing you all in the clinic after your transplant. I wish you well.